Here are 7 big mistakes that people make that worsen patellar tendonitis, which is also known as jumper's knee. Number 1 is that people will strengthen their quad muscles, usually at the guidance of a healthcare professional, but that actually feeds into the root of the problem. The reason that the quad exercises feed into the problem is because those quad muscles, they all converge, they all come together and make up this quad tendon that attaches to the kneecap, and then it runs down to where your knee pain is for the patellar tendonitis. And if those quads get stronger and stronger, they add more and more tension to that tendon, which ends up tensioning the tendon more and making the problem worse. So it doesn't make sense to do more quad exercises. People will sometimes say, healthcare professionals will sometimes say that the quads are weak, but if you're developing patellar tendonitis, jumper's knee, then it's a sign that you're overusing your quads, that your quads are too dominant and likely compensating for a weakness somewhere else in the body. Number 2 is that you rest too much. Now, resting's okay, especially if the knee's really painful, if you have swelling. Rest is a good thing because you need to allow the tendon to recover, and not using it allows it to heal, for the swelling to go down, for the body to do what it's supposed to do. But once you feel better, you can't just keep resting. You have to begin to do some movement. Now, it's important to do the right exercises, especially exercises that are focused on correcting the muscle imbalance that feeds the compensation, because if you correct that muscle imbalance, then you'll stop the quads from compensating and adding too much tension to that tendon right here. Number 3 is focusing on stretching. I've seen too many patients take 30 minutes, 45, even an hour stretching their quads, foam rolling on their quads, self-massaging their quads. It's not just stretching, but stretching is probably the main thing that people will focus. And they'll bring their foot, their heel to their butt to try to stretch the front of their thighs. They'll do lunge stretches. They'll do all kinds of stretches to free up motion in the quad muscle. And it might help temporarily. It often does actually, but it doesn't address the root muscle imbalance. It doesn't keep the quads from compensating more than they are already. It just frees up tissues, it just gains more mobility, but it's temporary. I'm not saying don't stretch. If you find that it's helpful for you, go for it. But most of the time, people get enough stretching done within just a few minutes, within 5 minutes or less, to get the relief that they're looking for. Usually, if you're doing more than 5 minutes of stretching, you get what's called diminishing returns, meaning for more time you put into stretching, you're not getting that much more benefit. But some people are doing the stretching in hopes that it's going to fix the problem for the long term, but it just doesn't do that. Number 4 is relying on braces and straps. People will often go get knee braces at the recommendation of a healthcare professional, or they'll just do it on their own. Maybe they get the recommendation from the internet, and they sell knee braces at just about any sporting goods store or any store that has a pharmacy with a first aid department in it. And the knee braces might actually help with pain temporarily. They won't fix the problem completely. They won't get rid of the pain completely. They may allow you to continue an activity with the brace on with slightly less pain, but they don't help the quad muscles stop overcompensating. They don't take tension off the patellar tendon. So you can't rely on the brace to fix the problem. Your best bet with the brace is to temporarily reduce the pain and hopefully not take as much pain medication if that's something that you're doing. Which leads me to point number 5, is relying on pain medications. And we have some people that come in and they say, I've been playing my sport, I don't want to let my team down. I'm on the basketball team, I'm on the volleyball team, I'm on the soccer team, the football team, and I take ibuprofen every day before practice and before games, prophylactically, so that they're not having to deal with the pain in the middle of practice or in the middle of the game. This is not good because especially ibuprofen, which is a non-steroidal anti-inflammatory drug, NSAIDs for short, it's part of a drug family that helps to reduce inflammation. It is known to cause stomach problems that can lead to internal bleeding if it's used consistently enough. Now, using it once or twice, as long as you don't have any reactions to it, any side effects to it, immediate side effects to it, allergies as well, using it here and there is not too big of a deal for most people. But if you're using it on a consistent basis, it does become a big deal for everyone. And the reason for this is because it doesn't allow the lining of the stomach to regenerate itself, because inflammation is a necessary part of healing, and you need inflammation to happen, otherwise you can't heal. So it kind of doesn't make sense to be taking an anti-inflammatory medication for a prolonged period of time. Now, of course, pain medications only provide short-term relief, so it's not a good idea to rely on these medications in hopes of it giving you long-term relief. Number 6 is forcing your way through exercise when it's painful. If you go do that run or go start practicing or go play your sport, whatever it is, and you get pain right away, but you force your way through it. People often do this without realizing they're doing this because it tends to get better. People oftentimes will say, well, it hurts for the first 5 or 10 minutes, and then my knee feels fantastic after that, and I can play just fine. I can run just fine. This is false feedback. It's your body releasing endorphins, which is a safety mechanism so that you can fight your way through a dangerous situation without pain stopping you and get to safety or help someone near you, a loved one, something like that. But when it comes to playing sports or running for exercise, this is not a body function that you want to force your way through, because what's happening to the tendon is it's getting worse. You're continuing to put more tension through it, and if you've progressed through this, if you've been doing this for a while, you'll find that it begins to hurt all the time. And the endorphins aren't enough to get over the pain after a while. Then it begins to hurt when you're sleeping. It begins to hurt when you're just sitting having a meal. The problem festers, it worsens over time. So you need to listen to that pain. If you have that pain at the beginning of exercise that goes away, you need to be warned that it's only going to get worse if you continue pushing your way through it. No pain, no gain is not a good mentality to have with patellar tendonitis or jumper's knee. No pain, no gain is for when you're feeling fantastic, you don't have any pain, and really the pain that you're talking about is the fatigue from exercise. If you're dealing with extreme exercise fatigue, as long as your technique is okay and you're not going to hurt yourself somehow, then it's okay to kind of push yourself. It's more of a mental game at that point. But when we're talking about knee pain, you need to make sure to back off at the right time when it starts to hurt, so that you're not going to run into a worse injury in the coming weeks. Number 7 is not getting specialized help to solve the root problem. Now, I've kind of already been alluding to this throughout the other points, but getting specialist help. Now, me personally, I'm a specialist at helping people avoid surgery, injections, and medications and getting back to being healthy, active, and mobile. Now, I'm a specialist physical therapist. Most physical therapists help people right after surgery. They help them walk in the hospital. Maybe they see them at home after a surgery, or they have a clinic where they come in to recover from the surgery and get back to walking again. But what they're not doing on an everyday basis with every patient, as we do here in our clinic, is help people avoid surgery, not rely on medications, and avoid injections, and get back to being 100% active again at a competitive level if that's their goal. As a result of our specialty, we're looking at muscle imbalances in depth, and that's what we do day in and day out here. And so our approach to fixing the root muscle imbalance that leads to patellar tendonitis is solid. We consistently help people recover from patellar tendonitis, jumper's knee, not just in the short term, we know how to do that very well, but we also help them knock it out once and for all so that they know how to maintain their strength in their body properly so that they can get back to full speed jumping and running and sprinting and doing everything they want to do and not worry about the knee pain coming back in 6 months or next season or in any season in the future. As long as they maintain the proper strength and they're not developing compensations, then they should be just fine. And most importantly, they're not setting themselves up for knee injuries that haunt them later on in life, like meniscus tears and knee arthritis, and having to get things like a knee replacement done. Because if you fix this muscle imbalance now in your younger years, you should have great knee health the rest of your life. If you're looking for help with this treatment approach, I've packaged it into a program called the Patella Pain Recovery Program. It's over 30 videos of me walking you through our treatment approach step by step as if you were here in the clinic with me. You can access this program from any device that has an internet connection and a screen. You can see me talking to you, guiding you through every step of the way. And these videos aren't on YouTube. They're exclusive to our Patella Pain Recovery Program. Now, if you're not ready for that program yet, we've got tons of videos here on YouTube for you to watch. You'll find a link to the playlist of runner's knee and jumper's knee down in the description below. And also in the description is a link to our patella pain recovery program if you want to go learn more about that. Hey, if this video was helpful for you, give us a thumbs up. Hit subscribe so you don't miss out on any of our videos that we post in the future, and turn on that notification bell as well so that you get notified. And if you have any questions, comment right here. If you have questions about patellar tendonitis, jumper's knee, or any other knee problems, we'd love to get back to our comments as fast as possible. I hope to see you in the next video. Bye-bye.